Morning today. As the Omicron variant continues to spread, there's new concern about pregnant women and the COVID-19 vaccine. So here to talk about all of our concerns, Dr. Alyssa Arabobo. She's joining us live from Los Altos to discuss this issue this morning. Thank you so much for joining us, Doctor.
Good morning. You're welcome.
So,
Love to talk about this topic.
Yeah, it's a very important topic. Of course, Omicron dominating our headlines right now. And what I wanted to talk about was a little bit ago in the summertime, I talked to a woman who got pregnant and she had her child. She was diagnosed with COVID while she was pregnant. When she had her kid, she became gravely ill. So, and this has been actually a common occurrence with pregnant women. Why do pregnant women get really sick when they are diagnosed with COVID?
Well, it comes with many diseases that happen in pregnancy. So even with the flu shot or even the flu, anything of that, because when you are pregnant, you become more vulnerable and your immune system is vulnerable as well. To susceptible to those outside viruses and different bacteria that can come into a woman that normally as an adult it does not affect you, but when you are pregnant you do become more vulnerable, which is imperative for most of all of our women to become vaccinated, because that vaccination has shown and the data has shown when they do have their first immunization and then their second, they are more likely to be able to combat COVID-19 like they are if they were an adult and they weren't pregnant. So it's so imperative for women to do this.
And I think a lot of pregnant women, they have either, they're just worried or they have misconceptions about if the vaccine will affect their child. And we still, the data is still going out on this. I mean, what can you tell women that are still sort of concerned about getting the vaccine and what this would do to their bodies?
They need to just really talk to their healthcare provider or their physician and really understand the data and what the science is showing us. And it does show us that women who are vaccinated do better than those who are not, which is what we see every day. It is showing that for the woman that is vaccinated, her baby is also protected because those antibodies go to baby. So intuitively, it makes sense that getting vaccinated is the right way to go in order to combat these different variants that are coming and be able to have a health and safety pregnancy with COVID-19 still being a pandemic here.
And really, real quickly, I wanted to mention that in Sacramento County, the Black community is one of the least vaccinated groups here. And I know you guys are pushing out an effort to get more people in that community vaccinated, pregnant or non-pregnant alike. We do appreciate your time. We're running out of time, but thank you so much for talking to us about this important subject. Dr. Alyssa Arabobo joining us this morning. Thank you.
Thank you.
Okay.